Welcome back to Open Line tonight. Thank you for being with us. I'm here with Representative Sexton from Crossville on the Opioid Task Force, a group of lawmakers really looking to dive into this problem that Tennessee is facing. And here are some stats that knock my socks off, and I hope they will to you as well. Tennessee leads the nation in the number of opioid prescriptions per person. And also, in the last 5 years, more than 6,000 people have died from an overdose. We're talking about deaths. We're not talking about the number of people who have overdosed. We're just talking about the number of people who have died, more than 1,000 a year.
Right. Well, and if you want to use the metrics, there's a metrics out there. So for every person that has died, there's 10 that have gone to seek treatment. There's 32 ER visits.
Wow.
There's 130 people who abuse or are dependent, and 825 non-medical users. So you know, it's kind of like the analogy: if you make so many sales calls, you get so many of this, you get so many. It's the same thing for every overdose. You have all this in waiting, and that's why we're at an epidemic portion.
And I just don't think about the 6,000 people who have died. I think about the 6,000 families of those people who have died. We're talking a lot of people affected by this, and often it's behind closed doors because it's shameful to a lot of people to say, I have a family member who is fighting addiction. There is still a lot of shame in that, even though so many people are dealing with it. Are you finding that? Is that what this panel is?
I mean, there's a stigma. You talk to anybody who's gone through it and come through it clean, I mean, there is a stigma, and it stays with them for life. It's like anything else. And one of the things we found out in task force meetings is when you look at the treatment programs, is it takes 18 months for the individual's brain to be drug-free, to come back to where the frontal lobes can make decisions.
Really? And 18 months?
So 18 months. So basically what happens is our treatment programs are so short that we're setting them up for failure. It doesn't mean they need to go through a comprehensive program for 18 months, but what you need is you need to have mentors and counseling and so forth that are still there, allowing that person, because until, anybody will tell you, until those frontal lobes are able to make those decisions, they still have that euphoria of high and so forth, and it's a struggle every single day for them until they can get to that point. And even after 18 months, it's still a struggle. But they tell you they can find ways to cope with it after the fact, but they need to get to that benchmark to have a chance.
And just imagine if you have a relapse in that 18 months, the clock starts ticking again at 1.
Right. I mean, you can look at brain scans, and on day 1 of treatment, there's no color in the brain on any scan, and slowly over time it comes back.
Let's talk about what the state is doing on the very big picture level. Some states are suing drug manufacturers, saying you didn't tell us, you didn't tell doctors how addictive these drugs were. So they're kind of going at this from, you know, let's tackle what's happened.
Right.
Where does Tennessee stand on that?
The Speaker asked the Attorney General to look at it, and so he's looking at joining, I think there's some other states, to see if that's something that Tennessee wants to do. I think you've had some district attorneys up in Upper East Tennessee in the Kingsport, Bristol area looking at doing that as well. I think one of the things you have to be careful of, are you doing it because you think they're guilty, or are you doing it trying to fund a program? And so you have to be very aware of what's going on. What I will tell you, though, is we're all guilty. It's not just drug companies. I mean, they're guilty from 20 years ago, but in the last 10, 15 years, there's been protocols in place to handle it. A couple pharmaceutical companies have been sued by the federal government and paid out huge money before, so they have been sued, and they have been, not by states, but by the federal. But, you know, we're all guilty. Insurance companies are guilty. Their own formularies they have to pre-approve. You know, insurance companies aren't allowing alternative treatment plans. You know, unfortunately, we're a society of where it's easier to take a pill than to do your action. You look at diabetes. You know, it's really hard to control your diet. It's a lot easier to take an injection sometimes. And so, you know, whatever it may be, we want to take the pill because it's the easiest, quickest thing to do. And so trying to treat the addiction and the mental health and the pain and working with chiropractors and physical therapists in coordination with physicians is a harder thing to do. But I think it's at the point where we have to redefine what healthcare is. And helping people through pain. You know, I mean, my grandparents had pain all their lives. It didn't mean they went to go take a medication to have no pain. And so, you know, in Tennessee, when we repealed the Intractable Pain Act, I think that was a step in the right directions. And the delicate balance is there are people who are cancer patients and who have chronic pain that need the opioids. So you have to be careful that you don't overregulate on them in trying to stop the bad players.
Yeah, I mean, this is a very tough problem. It's just like overhauling our entire health system right now. It's a tough problem. There is no easy answer.
Right.
That's why we want our best minds on it right now. You guys are hoping to come up with some recommendations for the governor just in the next couple of months.
Right. We're hoping sometime by early September, late September, to have some recommendations that we can put forth to the governor to propose in the next budget, because it's going to take money to fight this problem. You can't fight it without funding.
What is the treatment snapshot available here in Tennessee that people have?
Well, it's all over the place. There's no really guidelines. You know, we have guidelines for a lot of different disease states, and you know, there's no guidelines. So you have people who think, you know, complete detox is the way to go, just cold turkey.
Sure.
You have others who think that it needs to be a Christian counseling. You have others who think it needs to be a combination. There really is no set pattern. That's one of the things we're struggling with. Everybody kind of has their own direction, so you really don't know which way to go. So we have to do a better job of getting guidelines in place to handle the situation, as well as trying to figure out how to do a better job of treating.
And I know we have Teddy on the line. I'm going to get to you just in a second, Teddy, but I do want to mention this. And the families that I have talked to who are dealing with this, they always say, we can't get a bed. We can't get a bed to get our daughter or son in treatment.
That's right. I mean, it's very tough. I mean, you talk to any hospital, and they can tell you, even for a mental health patient, to trying to get them into a place, there's just not many there. And so when you look at the uninsured population in the state of Tennessee, which is about 400,000 people, roughly, about 120,000 have a mental health issue that are uninsured. And then you look at the addiction problems and everything else. It is a problem, and people don't really know if it's inpatient treatment's the best or outpatient treatment. And so really, I mean, realistically, we really have to relook at how we're going to do healthcare in the state of Tennessee and try to be a leader and look at what other states have done so that we can continue to move forward.
Let's jump to the lines. It's Open Line. We'd love to hear from you. Numbers at the bottom of the screen. Teddy is on the line with us. Teddy, good evening. What's your comment or question?
Yeah, I'm sitting up here watching your show, and it's very interesting to me because I happen to be addicted, and I'm addicted to the point where it's just unrealistic. And I do have insurance. I have TennCare. I've been to treatment 5 times in the last 3 years. Problem with that is you can't get no medical help. I got a medical problem. I've been on opiate drugs for 31 years.
Wow.
I've never had an addiction problem until the last 4 years. And the reason I got an addiction problem is because legislation is legislating everything to the pain clinics. Pain clinics in Tennessee is pill mills. We all know it. You know it. Others know it. Everybody knows it. It's no secret. So until you stop legislating something where the doctors can't take care of the patients, you're never going to get a handle on the opioid crisis. It's impossible.
Teddy, how do you think this has affected your life?
It has turned it completely upside down in the last 5 years.
How has it? Are you working? Have you been in trouble with the law?
I'm 68 years old. I fell off a 4-story building 31 years ago. All this crisis come up with me over a $1,250 back brace because TennCare can refuse to give you anything unless it's a life or death situation. They refused to give me a back brace. My opiate addiction kept going up, kept going up, kept going up. Got to the point it was intolerable. I went to treatment. Never been to treatment before. I went to treatment where I found out treatment don't do you very much good when you get out if you still got the same pain, because you're going to go right back to the same opiates.
Yeah.
It's just like a never-ending cycle, man. And you guys keep sending legislation where doctors can't do anything. They can't do nothing because the insurance companies and the DEA won't let them do anything. They're scared to do anything because they're scared they're going to lose their license.
Yeah.
They don't care about me as much as they care about their license. Now, that's for sure.
Teddy, you have touched on a lot of things that we've already touched on. I thank you for your call. I wish you luck. I know it's going to take more than luck to kick this addiction, but thank you for putting this in perspective. And I know you've heard stories like Teddy's, and you touched on the things. We got a lot of pain clinics in Tennessee right now that are unregulated, and that is a big problem.
Well, I mean, they're regulated now because they have to be licensed in the state of Tennessee. What I will tell you is the General Assembly does get a lot of fault because it's easier to criticize us for passing. And so I hear a lot that physicians say that they can't write something because the legislature says they couldn't prescribe it. That's not the case. They still have the same capability. The difference now is people are watching, making sure that in that database, the top 50 prescribers. What I will tell you is the top 50 prescribers in the database, we were looking forward to the day when an oncologist became a top 50 prescriber.
That's not happening?
It barely just now, but it's taken years to get to that point. And so what I will say is part of the problem, I hear this from physicians all the time, is physicians, due to insurance companies, can't treat how they want to sometimes because they have to get prior authorizations and go through this protocol to this protocol to get where they think they need to go. And so I think part of the problem is we have a health industry that's really regulated by the insurance companies to a large extent, and the physicians a lot of times feel like that they have to go through certain hoops to get things approved to help the patient.
Right.
So whether it's a back surgery or back injury, they have to go through 5 things when they know those 5 won't work because that's what they're told they have to do to get reimbursed. And and what I will say is opioids are needed. The problem is the longer you're on it, the more you need because it gets to a certain point. And so, when people struggle to get off and they don't have the health care there to make it better, it really is painful. And on TennCare, there was a bill this last year, and all the bills have fiscal notes on them. And in that fiscal note on TennCare has 30,000 individuals on TennCare who take an opioid every single day of the year that we're paying for. And when you look at that, that tells you that there's something broke because someone should not be on a pain medication 365 days a year every single day or every single year. So we have to go back and look at how we give physicians more control over the patient's health, not less control. And a lot of times that stems from the managed care organizations.
Do you think that's going to take legislation to get the insurance companies to change how they do things? Or are insurance companies starting to pay attention and say, wait a second?
Well, I mean, it's a little of both. But what I will say is when you try to tell an insurance company to do something, they call it a mandate. And so, but we really have to refocus our efforts. And when you talk to a chiropractor or you talk to a physical therapist and they have individuals that they describe to us, which this person's been on pain meds for 4 years and they got to a point where enough was enough and they went to a chiropractor per se, and the chiropractor did a little work and looked at it, and then within 6 months the pain's gone because it was something poking on something which I don't understand. but the person came off the pain meds. So that doesn't happen in every case, but what that does tell you is we're more willing to prescribe an opioid to somebody than we are willing to try to see what the problem is to fix it sometimes.
Exactly so. Okay, we have to take another quick break. I know we have Taylor and David and Angie on the line. We're going to get to you right after this. Stay where you are.